first step, always check to see if safe. So that we want to approach them. Are you okay? Are you okay?
Okay.
No response, call on 150 AED. Now here's the added step. You want to check their pulse, right? So you know how to check your carotid artery.
Yeah.
It's over here. Show me where it is. You feel it?
Yeah.
Alright. So if you feel a pulse, then you can give the rescue breaths, and we'll go over that after. If you don't feel a pulse, then you want to do compressions and breaths.
Okay.
So no pulse, no breathing, no responsiveness. It's full CPR.
Pulse, breathe, and now give breath and
Yeah. But if there's no pulse, no breathing, you want to do full things. If there is a pulse, then we'll do rescue breaths. And we'll go over that after. All right. So now you have help on the way. You've already assessed the victim. Once again, bare the chest, keep them on hard flat surface. You always begin with your 30 compressions. So we can do our 30. 1, 2.
Count out loud.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And then we're going to give the 2 breaths with this bag valve. I'll show you how to give it first. So it's called the C and E. You want to place it over, right? We're basically making a C and an E. So right here, right? I'm going to grip this up to you. And this is your C on this hard part, and this is your E with these 2 fingers to open the airway. And then you want to give the breath like this. You want to let it fully come back up. I'm going to give the second breath. So go ahead and try that. So because there's 2 of us, go back in. Make sure that it's sealed tight. This is the little beak of it, right? C, perfect. And then the little E, lift it up, perfect. Squeeze, let it come all the way up. And then get that second. Perfect. So for BLS, it's 30 and 2 for an adult, right? But now let's say there's 2 of us. So if me and you were taking care of this person, we would do 5 cycles of CPR, and for the 5 cycles, I would be doing the compressions for all 5, and you would be giving the 2 breaths. Okay. And then after the 5 cycles, we could switch. Okay. But it has to be consistent for at least 5.
Okay. So for 5 cycles, you're doing it.
Yeah, and you're doing the breaths. Okay. And then after 5, we could switch. Okay. So you just have to be consistent for 5. Constantly doing the compressions and keep giving the breaths. So for obstructed airway on an adult, you want to approach them from the side always, because you don't want them to be coughing and then them choke out the object or spit it on top of you. So if you see an adult choking, real quick, do you know the universal sign for choking? Like this. Yeah. Universal sign. So if you suspect someone is choking, you want to approach them from the side, hand on their shoulder, and ask, "Are you choking? Are you choking?" You don't want to be like, "Are you okay?" Because then people might think it's like some sort of emotional thing. You want to say, "Are you choking?" If they're not getting anything out to you, or they're just like kind of struggling or coughing it, you want to encourage them. But if they're not making any progress, then that's when you want to deliver that Heimlich. So it's a fist with the hand. You want to cover it with the other hand, thumb side in, and it's right above the belly button. Yep. And then you want to go in and up at a 45-degree angle from right above the belly button.
With the thumb like pointing up, like right here.
Thumb pointed in, you'll put this.
Okay.
So go ahead and do that real quick. Perfect. And just go in and up. Obviously be harder than that, and they don't compress because it's a mannequin. But yeah. So now let's say you've been doing this. Usually the object will come flying out, but let's say it's stuck really deep in there. This person's gonna pass out because they haven't been breathing. So you wanna bring them down gently. Make sure you get their head down gently as well. And now you have an unconscious victim. So what do you think you should do?
CPR.
Before that,
Check that.
call 911. You have an unconscious victim. So now you know that one's on the way. You wanna begin your CPR. So hard flat surface, spare their chest, and then you begin with the 30 compressions. This time, added step. After 30 compressions, before you give your 2 breaths, you just want to check them out. You only want to reach in their mouth if you see the object. If you don't see it, don't do a blind plate. Okay. But if you look in and you see it, then you want to grab it with a gloved hand. Yeah. If not, just try to give the 2 breaths as best you can, and then go back into the 30 compressions.
So this is after the 30, then you open and check.
Yeah. Before the 2 breaths. And even if you don't see it, try to give the 2 breaths as best you can, and then go back into 30 compressions.
Okay.
Now, this person may start throwing up, so in that event, just put them into the recovery position and let them relieve themselves. Now, let's say this person's too big or visibly pregnant, so you can't get your hand around their belly. Then you would do the compressions like where you would do normal chest compressions. So, okay, yeah, that's it.
If you're by yourself and you're
If you're
choking.
by yourself and you're choking, you would do the same thing, like same hand position, and you would kind of bend yourself over like a chair like this. Scoop. Yeah.
And 30.
What's up?
We do 30.
It's not like a number for the Heimlich.
Okay.
It's kind of until it comes out or they pass out. The number's only for the CPR.
Gotcha.
Yeah. Any emergency situation.
You check the scene. You look
All right.
around.
The scene is safe. No.
Now you see the kid is unconscious and you call the cops.
Yeah.
911, get the AED.
All right. So let me see how you would check for responsiveness.
You okay? You okay? You okay?
All right. Now that you've called 911 and got the AED, what do you want to do next?
Now I want to put my hand down. Pulse. Check the pulse first.
Okay.
It's got to be 10 beats in 10 seconds. That's breathing, right? Responsive. And then if it's less than that, then they're not breathing.
Yeah.
They're not. Yeah.
Okay.
I need to do CPR.
Yeah.
Okay.
All right. Perfect. So let me see your 30 compressions.
Gotcha.
With
One hand.
Yep.
And the third of the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And then you would give your 2 breaths.
Yes.
Perfect. Go to the adult. Of course, from the side. Are you choking? Are you choking? So the only difference now is obviously children are smaller, so you might have to like go on your knees to do it instead of standing up. So yeah, same placement right above the belly button. Just go in and up. And then if they go unconscious, lay them on the floor as softly as you can.
And then start holding again.
Call 911 and then CPR. So it's the same exact thing as an adult, pretty much. It's just that they're smaller.
And you can't lift them up. They have to be on the ground. You do this.
Preferably on the ground, but if you're too strong and their feet leave the ground, I guess it's okay.
Okay.
Yeah.
It's a good idea to go up behind them on your knees and do it versus lift them
Yeah.
up. Yeah.
Okay.
So just go down on your knees behind them and then do it. Yeah. So now if they've passed out, what's next?
Now put them on the ground.
And then
Check. Call 911.
start compressions. Go ahead.
2, 3, 4, 5,
28, 29, 30.
30.
What's the additional step?
Give them the 2 breaths.
Before the breaths.
Or the breaths, because they were choking. You have to check their mouth.
Check their mouths.
Yeah.
And if it's visible, I take it out. If it's not,
Yeah.
give them the breath.
Perfect. Gotcha.
So each time you come back up after doing the compressions, check the mouth before you breathe
Before
further.
you give the breath.
Yeah.
So CPR as infant, same thing. Check the scene is safe. You know, it's rare that you'll find an infant by themselves, but once again, always check the scene is safe, assess. You want to approach them. You can tap their shoulders, but babies are more sensitive on their feet, so you don't like tap their feet, rub their feet. Baby, are you okay?
Okay.
So no response. I won't get the ED. Now for babies, you don't check their pulse up here. Check them on their brachial artery, their bicep. So you would check that. Same thing as a child though. If it's under 10 beats in those 10 seconds, then it's considered no pulse. And then that's full CPR. So now that we've determined that they have no pulse and they're unresponsive, help is on the way, we can begin our CPR. So place on a hard flat surface, bare the chest. You can do infant compressions in 2 ways. So you can either do the 2 fingers, or the way I like to do it is a 2 thumb and circle technique. So you basically use your 2 thumbs, and in the same area you would done the compressions, you push down like that.
Count out loud. Do
9,
30 of
10,
those.
11, 12,
13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
And then for mouth to mouth breaths, obviously I'm going to go with bag belt, a can. For the baby, the difference is your mouth is a seal for both the nose and the mouth. So when you give the breath, you have to cover both the mouth and the nose. Yeah.
And you only do mouth to mouth, adult, child, or infant if it's a known person. Do not put your mouth on. Remember, we taught you hands only CPR for adults and teenagers. So don't put your mouth on somebody that you don't know, because you are the most important person. So as a nurse student or in the medical field, you'll have access to the ambu bag, which will be size specific for adult, child, or infant. So use that versus putting your mouth. But if it's a known infant, cover the mouth and nose both when you give a breath.
And then if it's me and you on the same infant, switches to 15 and 2 for 5 seconds. Then we can switch.
But it's 30 if it's BLS.
Yeah. So let's say now someone gives you their baby or infant that's choking. Babies won't make like the universal sign for choking. They're too young to know what that is. So a big sign is usually if a baby's like not able to breathe, their lips will turn blue, or they'll just be struggling to make noise. But the big red flag is blue lips. Yeah. Anyways, if they hand you their choking baby, you want to take the baby. You want to make a V with this hand. Cover the face. The point of the V though is that you can basically grab their face, but keep their nose and their mouth exposed, right, like this, and keep your forearm down the center of their chest.
Or no?
You can use your leg as like support, and you want to flip them over, this, right, and then you want to strike the back.
Yeah.
You want to strike their back like this, wrist like this. You want to do it 5 times. And then you want to flip them over, so press their head, forearm down the center of their back, and you want to give 5 compressions. Like this. 1, 2, 3, 4, 5. And then same thing, V, forearm, flip back over, and 5 backwards. 1, 2, 3, 4, 5. So you just keep this repeating this process until either the object comes out or the baby was going to go limp in your arms and going to pass out. And then once that happens, we're going to place them on the floor, hard flat surface, bare their chest, and now you have an unconscious baby. So now with the baby, you have the freedom of when you're doing CPR, like you can walk to the phone or do your compressions essentially. If you can hold the baby if you're strong enough, you can walk and talk. If not, place them on the floor, call 911, and you want to begin your 30 compressions.
So do it.
So let's get down on the floor. You already called 911, and you want to do 30 compressions.
Count out loud.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then, before we give the breaths, check them out. So for a baby, we don't tilt their head nearly as far back as we would for an adult or child, because babies don't really have necks yet. And then, like I said earlier, for mouth to mouth on a baby, you want to cover both their nose and their mouth.